If you're dealing with pain in the front of your hip, then you're in the right spot. I'm Dr. Brian, and this is Movement is Mandatory. And today's video is a protocol that is going to help you get rid of that hip pain or tightness that's occurring in the front of the hip. All you're going to need is your body for this video, so let's get moving. All right, so today's video is going to be 3 different movements where we're going to really try to get that stress to the right areas of the hip opposed to where it is right now. Typically, if you're having pain and stiffness in the front of the hip, it's coming from an imbalance where you're overloading or your system is too reliant on these muscles, your hip flexor muscles into your lateral quad. We need to get that stress back to more of the other glute muscles, particularly glute med and glute max, and get that hip through a little bit more of that range of motion that just isn't comfortable doing. So we're gonna go through a couple of different movements. We're gonna do a couple rounds of each to help get those hips a little bit more loose, to help get that stress back to where it's supposed to be, to start give you some relief so you can get on with what you need to do with your workouts, training, or just daily life. So what we're gonna start with is this sideline hip raise. Now you may have hip pain on just one side, but we're still gonna do both just to make sure that we're getting both sides. Because even though it might be on one side, the other side might be the culprit. So this sideline leg raise is what we're going to start with. So you're going to be on your side. You're going to keep your top leg, your toes are turned down towards the floor, your knee is slightly bent. You are just trying to raise that leg for 10 slow controlled reps up towards the ceiling. Now when you do this, we're making sure you don't go forward. You're trying to go up in line with your body, or even if you're able to do it, slightly back. But the further you go back, you have to make sure you're not arching through your spine as you do this movement. So we're doing 10 reps, keeping that knee bent, that toe down. You should feel all of that stress in that back pocket. After 10, we're going to switch to the other side and do the same thing. So let's get 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we're going to do another round of this. So this time we want to try to get that leg a little bit higher and a little bit further back if you can. Get 3, 4, 5, 6, 7, 8, 9, and 10. And that stress should all be in that hip. You should not feel it in the front of the hip. If you feel it in the front of that hip, you gotta lean forward a little bit more. You want to keep your belly button a little bit more forward so you can really focus. Get 10 reps on this side and getting that stress to where it needs to be. And you might feel one side is a little bit harder than the other. But the more you can control it, the more you can make that connection, keeping your hand right on that hip. So those muscles, that's what's going to make a difference. Do one more rep. Good. So the next movement is going to be a plank kickback. So what we're doing with this is we're going to get into a plank position. And what we're going to do, to show you from the side, is we're going to do the right leg first. We're going to do 10 reps. Your foot is outside of your knee and you're kicking out to a 45. And as I kick, I'm trying to kick my leg all the way straight. Getting that stress as I kick out should be in the hamstring and should be in that back pocket area that you just worked. So we get 10 reps. You get 2 more, get to 10. And we're going to do 3 rounds of this. So we're going to get 30 good reps in on each side, making sure that foot stays outside of that knee. We do that to keep it in an internal rotated position. 2 more reps, get to 10, which helps keep that hip flexor turned off. 2 more sets. Back to the right. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And you're seeing I'm not going up. I'm going just parallel to the floor. We don't want to go up to make our back fire. We want to keep it just all that isolation through the hip. 10 on the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. One more set. If you need to take a break, just pause the video. But we're going to get all these reps. We're going to burn these hips out. And we're trying to burn the backside, which is going to really help overload that tissue and that brain to muscle connection so your brain doesn't keep thinking about those hip flexors. Got 5, 6, 7, 8, 9, 10. You may be thinking, why aren't we stretching? We don't need to stretch when we're dealing with hip flexor tightness, because the tightness it's presenting as tightness, but it's really a stability issue. It's telling us that your system is relying on the wrong things and it's tightening down to try to stabilize so you don't fall over. So that's where the more we activate, we're going to get that mobility, but we're also going to get that strength where we get more lasting effects than the temporary relief we get with stretching. One more rep, get that 10. All right, so after you've gotten 3 sets 10 with those kicks, the last exercise we're going to do is a marching bridge. So now what we're going to do is we're going to show you from this side first. So I'm going to get into, show you this side first. So my feet are outside of my hips, my knees are inside my feet. Again, this position allows us not to use those hip flexors. So I'm going to go up into a good stacked position where everything is in that good alignment, knees are still in. And now I'm going to push down as hard as I can through my left foot, and I keep my arms out to help stabilize as I bring my right leg up and vice versa. So we're trying to keep our hips up the whole time, and as our foot comes down, our feet should still land outside of our hips. We don't want our knee to go out this way. That's what kicks in the hip flexor. So knee stays inside of foot the whole time that we do this. You will probably feel a little hamstring, but you should also feel that back pocket area that you just worked. You should not feel it in the front. Might be a little bit of a stretch just because you're in this position, but the stress should be on the back side. We're doing 10 of these. 10 on each side. I think we're at 6. We'll call it 6. So that's 7, 8, 9, and 10. All right, we'll come back down, rest for 10 seconds, and then we're going to do another round. So same thing, you're trying to get your feet as close as you can to your butt. Arms at the side, so my hips up are as high as they can go. Knees are inside of feet. Push down. 1, 2, 3, keep those knees inside your feet. 4, make sure your feet land outside your hips. Don't let them come in. 5, 6, 7, 8. Feel yourself pushing down through your feet, keeping those big toes down. 9 and 10. Perfect. All right, and go ahead and stand back up and just see how that feels. If you feel your hips should feel more loose as you're kind of taking some steps, should feel like that tightness isn't there anymore. If you go ahead and do a squat, should feel like it's more opened up through that hip capsule as you go through that squat pattern. But that's the goal, is getting that stress back to here when we're dealing with front of hip pain and tightness, is getting that stress back to where it needs to be. So it's a very effective protocol that I utilize all the time with my clients that you can do or just did, and you should feel those results. If you do, please like, share, subscribe. If you have any questions, drop it below in the comments. Happy to answer questions you have. I appreciate you guys for watching the video, and as always, I'm Dr. Brian, and thank you for making movement mandatory.